I'm Dr. Mike Milligan. We're here at the Woody Oaks Excellence in Dentistry meeting in Florida. Spring break seminar every year. It's a wonderful seminar, 3-day seminar. If you haven't been to it, please go. You get to learn so much about dentistry, all aspects, as well as new techniques, meet the speakers, great networking, and that's what we're doing right here. And we've got Rob Winnings, president of Sleep Optima. And Rob, thanks so much for being with us.
Pleasure to be here. Thank you very much, Mike.
Now, this is a kind of a new thing in dentistry, but a huge market that we're now able to help, and there's several reasons that it's becoming more into dentistry and something that many more dentists are doing. Rob, tell us about sleep apnea and maybe some of the devices that dentists can use and how you facilitate that.
Sure.
And where this is going and why it's come about that sleep apnea is becoming more and more a service that we can help people with.
Well, estimates range between 20 and 40 million Americans suffer from sleep apnea, and it is only 10% diagnosed. So we're talking about a very large market.
Okay, then yeah, you look at the whole market, that's huge.
And you take that number and maybe double it, and that's the number of people who snore in our country, which is a high indication. So snoring, sleep apnea come together, very large market. The diagnosis and treatment of that market is about a $5 billion industry.
Wow, okay.
So we're talking some big numbers.
That need help that we can help.
That's right. So for years, we tried to get this message out to primary care physicians.
Right.
And the challenge is primary care physicians are not good at actively screening patients. Okay. They have patients coming in the door, they have aches, pains, illnesses. Doctor treats them and then moves them on and then brings the next patient in.
Right.
Okay. So we had real trouble getting primary cares interested,
in actively seeking, questioning about sleep apnea.
That's right. Okay. That's right. Mm-hmm. So now, a few years ago, the American Academy of Sleep Medicine.
Okay.
Now these are the experts. These are the guys who offer board certification to sleep specialists. They offer accreditation to sleep labs.
Okay.
So everyone who's anybody in the sleep industry belongs to the AASM.
Okay.
Okay. AASM comes out a few years ago and says now it's an acceptable first-line treatment to use an oral appliance for sleep apnea.
Okay, and when did this happen?
2006, the guidelines came out.
Recent, and actually now we're going to talk about 5 things that have occurred recently, this being the first.
That's right, that's the first thing.
So this is why it's up and coming in dentistry.
That's right.
Okay.
Now, understanding, of course, that the gold standard in treatment has been a CPAP machine for the last 2 decades.
Sure.
If you're familiar with the CPAP machine, it's very, very effective therapy, but yet very intrusive. Studies show, in fact, the Wall Street Journal 3 months ago came out and said 50% of patients on CPAP within 3 to 6 months discontinued the therapy.
Okay. So they just don't like it.
That's right. That's right.
Even though it's effective, they just...
Right, exactly. So now we have an approved therapy that's a great alternative. So that's kind of the first, macro factor, let's call it, that contributes to this.
What's the second?
The second thing is, in order to get diagnosed for sleep apnea, which is a very important part of this, because you just don't want to treat a patient who snores. This patient could have serious sleep apnea illnesses, and you just throw a cheap appliance in his mouth. You got liability issues, all sorts of health concerns.
You need to have a proper diagnosis and know that this is an appropriate treatment.
That's right. That's right. So, so the ability to diagnose patients has traditionally been done in a sleep lab.
Right.
Now, as technology has advanced over the last 10 years, the ability now to diagnose patients in the home is now very affordable and very effective. And most of that has been because of the technology advancements in home sleep testing.
Sure. Okay.
The amount of data we can collect, the way we can score information using computer algorithms, all this information we can collect through various types of sensors. So all that has come about and created a real opportunity for home testing.
Okay, so improved technology allows this home testing to be accurate.
So there's your number 2. Okay. As a result of that, Medicare came out 3 years ago.
Okay, so this is number 3.
Number 3. And of course, Medicare, they're the biggest payer in the country.
Okay.
And because they're government, all their rates are published, so they really set the trends in the insurance industry.
Right.
And they set the benchmark.
Okay.
So when Medicare came out 3 years ago and said, we are going to now approve and pay for home testing.
Okay.
Okay, so Medicare now has made home testing legitimate.
Okay.
Now, that's interesting in itself. However, the really groundbreaking thing that creates is the monopoly on diagnosis, which was traditionally held by the sleep specialists and the labs.
Right.
They're the only ones who could diagnose, and because they made money on labs and they made money selling CPAP machines, that was the diagnosis, that was the treatment,
Right.
that's the way it happened.
Right.
But now, the subtle change now is the diagnostic process now is open. So a dentist can now assist in the diagnosis by doing home sleep testing.
Okay.
So that's a huge factor there, number 3.
All right.
Number 4, okay, is 2 years ago,
Okay.
Medicare came out.
2008.
2008 came out and said, these...
Medicare, you said this.
Yes,
Okay.
right, Medicare.
All right.
They're paying all this money for CPAPs, right?
Uh-huh.
And after 3 months, CPAP machines are underneath the bed. No one's using them.
50% aren't
Aren't using
okay,
them.
So there's a lot of money that they've paid out that it's not being used.
Exactly. So Medicare says, here's what we're going to do. We're going to pay for your CPAP machine for 3 months only.
Okay.
Then you need to show us you're using it, or we're going to stop paying.
Okay.
Okay? This happened 2 years ago. So now, the people who sell CPAP machines, they have to go to their patients and find out if they're using them. If they're not, then they don't get paid from Medicare through the insurance.
Right.
But the interesting thing that's happened as a result of that is now we have a readily identifiable population of people who have sleep apnea and have a therapy they're using.
So there's a database of that.
They're out there.
Okay.
So now, where do doctors and the people send these patients?
Right.
Okay. And so they're looking now. Okay. Before, okay, I'll put them on a CPAP, no problem. But now they're not using the CPAP. So where do we send them?
Okay.
And we're talking about millions of people out there.
Right.
They're looking for alternative therapy.
Okay.
So again, number 4. The 5th is as a result of all this. State dental boards are now looking at, is this the right thing for dentists to be doing?
Sure.
And there's a lot of people doing it the right way, there's a lot of people doing it the wrong way.
Okay.
So as an example, in the state of Ohio, my home state,
Uh-huh.
the Ohio State Dental Board recently came out, and we asked them, is it acceptable for a dentist to write an order for a sleep test?
Okay.
Okay, should that come from a medical doctor, or is it within the scope of practice for a dentist to do this?
Okay. And this is in Ohio. Every state's different?
Every state's different.
Okay, but in Ohio, let's see what happens.
Right, so in Ohio, they came back and they said, yes, it's within the scope of practice as long as the patient is properly screened. In other words, you just can't send everyone and his brother for a home test. You have to demonstrate that there's a need.
Okay.
As long as you do that, absolutely within the scope of practice of a dentist to do that.
Okay.
The second question we asked them is it acceptable for a dentist to perform a home test out of his office or through a third-party service? Can they initiate that test, keep control of it? And they said yes. However, they don't want the dentist interpreting the results. They want a doctor to who's trained to look at the sleep test results, come up with the interpretation and what have you.
Okay.
So they said yes to that. Okay. And then the third was, can a dentist treat based on the results of a sleep test?
Okay.
And the answer was yes. As long as a sleep specialist recommends oral appliance, they can go ahead and treat without getting an order from a physician.
Okay.
So this really opens up the door, for dentists to really get into this market.
Okay, well, wonderful. So that's why it's coming, and we really appreciate that information. And we're going to talk more about this on another video, the ramifications and then how to do it. So,
Great.
well, thanks so much for
Thank
being
you,
with us.
Mike. Yeah, enjoyed it. Thank you
Okay,
very much.
great.
All right.